Polycystic Ovary Syndrome, or PCOS, isn't just a hormonal condition. It's a complex disorder that affects millions of women worldwide, often in ways that go far beyond the reproductive system. While the underlying causes of PCOS are still being studied, what's clear is that its effects can be seen and felt throughout the body, including on the skin. For many, the first signs of PCOS manifest not in the ovaries, but right on the surface, in the form of unexpected breakouts, unusual hair growth, or changes in skin texture and color. Recognizing these skin changes can be an important step toward understanding and managing the condition. Let's explore 6 common ways PCOS can show up on your skin and what you can do about them. First, let's talk about acne, one of the most well-known and distressing skin symptoms associated with PCOS. Unlike the occasional breakout most people experience, acne caused by PCOS often appears as persistent, deep, and sometimes painful pimples. It tends to concentrate along the jawline, chin, and lower cheeks, though it can also show up on the chest, back, and neck. This is no coincidence. PCOS is characterized by an imbalance in hormones, particularly an excess of androgens, or male hormones, like testosterone. These androgens stimulate the skin's oil glands, causing them to produce more sebum. The excess oil, combined with dead skin cells, can clog pores and create the perfect environment for acne-causing bacteria. For many women, this type of acne can be frustratingly resistant to over-the-counter treatments, persisting into adulthood and leaving behind scars or dark marks. Recognizing that your acne might be hormonally driven is an important clue that PCOS could be the underlying cause. Dermatologists often recommend a combination of lifestyle changes, topical treatments, and, in some cases, medications that target hormones to manage this type of acne effectively. The second skin sign of PCOS is hirsutism, or the presence of excess hair growth in areas where women typically have little or no hair. This can include the face, especially the upper lip, chin, and sideburns, as well as the chest, abdomen, and back. Once again, androgens are to blame. Higher levels of these hormones can stimulate hair follicles in certain areas, leading to the growth of coarse, dark hair. Hirsutism can be distressing, affecting self-esteem and emotional well-being. It's important to note that not all facial or body hair is abnormal. Genetics play a significant role in hair distribution. But if you notice a sudden increase in unwanted hair, especially along with other symptoms like irregular periods, it may be time to speak with a healthcare provider. Management options for hirsutism include hair removal methods, such as waxing, threading, or laser treatments, as well as medications that address the hormonal imbalance at the root of the problem. A third common skin manifestation of PCOS is acanthosis nigricans, a condition marked by patches of dark, thickened, velvety skin. These patches most often appear in body folds and creases, such as the back of the neck, underarms, groin, and sometimes the elbows or knees. Acanthosis nigricans isn't exclusive to PCOS, but it is often seen in people who have insulin resistance, a hallmark feature of PCOS. When the body becomes less responsive to insulin, it compensates by producing more, and high insulin levels can trigger the skin cells to grow and produce more pigment. While these patches are not dangerous on their own, they can be a visible warning sign of deeper metabolic issues. Treating the underlying insulin resistance, often through dietary changes, weight management, and medications, can help improve the appearance of the skin over time. Topical treatments may also help lighten the affected areas, but addressing the root cause is most effective. Let's move on to our fourth skin sign: skin tags. These are small, soft, benign growths of skin that often appear in the same areas as acanthosis nigricans: the neck, armpits, and groin. Skin tags are common in the general population, but they tend to occur more frequently in women with PCOS, especially those with insulin resistance. The exact link between insulin resistance and skin tag formation isn't fully understood, but it's thought that high levels of insulin may stimulate the growth of these harmless skin flaps. While skin tags are usually not painful or dangerous, they can be bothersome or cosmetically undesirable. Fortunately, they can be easily removed by a dermatologist using simple procedures like snipping or freezing. However, just like with acanthosis nigricans, their presence is a reminder to pay attention to your overall metabolic health. The fifth way PCOS can show up on the skin is through scalp hair thinning, also known as androgenic alopecia, or female pattern hair loss. While some women with PCOS experience excess hair growth in unwanted areas, others notice the opposite problem, a gradual thinning of hair on the scalp, particularly at the crown or along the part line. This paradoxical effect is another result of heightened androgen levels. Androgens can shrink hair follicles on the scalp, shortening the growth phase and leading to weaker, finer hairs that fall out more easily. Over time, this process can result in noticeably thinner hair or widening of the part. Unlike male pattern baldness, which often causes receding at the temples, female pattern hair loss is usually more diffuse. Managing hair thinning in PCOS may involve topical treatments like minoxidil, oral medications that block androgens, or addressing underlying hormonal imbalances through lifestyle changes and medical therapy. Though regrowth can be slow and partial, early intervention offers the best chance for preserving hair density. Finally, the sixth skin manifestation to be aware of is increased skin sensitivity and a tendency toward inflammation. Many women with PCOS notice that their skin feels more reactive, prone to redness, irritation, or conditions like eczema and psoriasis. The exact reasons for this are multifactorial. Hormonal fluctuations can disrupt the skin's natural barrier, making it more susceptible to dryness and environmental irritants. Additionally, chronic low-grade inflammation, which is common in PCOS, can make the skin more prone to flare-ups and slow to heal from wounds or acne lesions. This heightened sensitivity means that skincare routines may need to be adjusted. Gentle, fragrance-free products, regular moisturizing, and sun protection become especially important. For those dealing with persistent inflammation or skin conditions, working with both a dermatologist and an endocrinologist can help create a comprehensive care plan. Understanding these 6 ways that PCOS can show up on your skin is more than an exercise in self-awareness. It's a crucial step toward taking charge of your health. Skin changes are often the most visible sign that something is happening beneath the surface. While they can be distressing, they also provide valuable clues for diagnosis and management. If you notice persistent acne, unwanted hair growth, dark patches, skin tags, scalp hair loss, or increased skin sensitivity, don't ignore these signs. They may point to underlying hormonal imbalances or metabolic issues that deserve attention. Fortunately, many of the skin symptoms of PCOS can be managed with a combination of medical treatment, lifestyle changes, and supportive skincare. Addressing the root causes, such as hormonal imbalances and insulin resistance, is key. Regular exercise, a balanced diet rich in whole foods, and weight management can all help improve insulin sensitivity and reduce androgens. Medications may be necessary for some, and dermatological treatments can address specific skin concerns. Just as importantly, emotional support and self-care are vital. Skin changes can affect self-esteem and mental health, but with the right tools and support, it's possible to feel confident and in control. If you suspect you might have PCOS based on these or other symptoms, consider reaching out to a healthcare provider. Diagnosis typically involves a combination of medical history, physical examination, blood tests, and sometimes an ultrasound. Early diagnosis and intervention can help prevent complications and improve quality of life. PCOS is a lifelong condition, but it doesn't have to define you. By recognizing the ways it can affect your skin and your body as a whole, you can take proactive steps to manage your health, find effective treatments, and embrace your own unique beauty. Remember, you're not alone. Millions of women are on this journey, and support is available every step of the way.